Imagine a normal day. You're talking with a friend, walking down the street, maybe just smiling to yourself. Then, suddenly, something feels off. Your face feels strange, like one side isn't quite working right. You try to speak, but the words get stuck, coming out jumbled and unclear. You try to lift your arm, but it feels impossibly heavy, weak. This isn't just tiredness. It's not stress. This could be a stroke. To understand what's happening, let's think about the brain. It's the command center for our entire body. Every single movement you make, every word you say, every thought you have, it all starts in the brain. But this incredible organ has a critical vulnerability. It needs a constant, uninterrupted supply of oxygen. This oxygen is delivered by blood, flowing through a complex network of arteries. When that blood flow is suddenly cut off, even for a moment, brain cells begin to die. And that, in essence, is a stroke. There are two primary ways a stroke can happen. The most common type is what we call an ischemic stroke. Think of it like a plumbing blockage. A blood clot, which might have formed somewhere else in the body and traveled to the brain, gets stuck in one of the brain's arteries. This clot acts like a dam, completely blocking the flow of blood. No blood means no oxygen, and the brain tissue supplied by that artery starts to suffocate. This accounts for about 87% of all strokes. The second type is a hemorrhagic stroke. Instead of a blockage, this one involves a bleed. A blood vessel within the brain weakens and ruptures, causing blood to leak out into the surrounding brain tissue. This leaked blood creates a pool that puts immense pressure on the brain cells, damaging and destroying them. While less common, hemorrhagic strokes can be particularly severe. So, we have two different causes, a blockage or a bleed, but they both lead to the same devastating result, brain damage. From the very second a stroke begins, the clock starts ticking. Brain cells are incredibly sensitive to a lack of oxygen and begin to die within minutes. We are talking about losing nearly 2 million brain cells for every minute a stroke goes untreated. And here's the crucial part. Once these brain cells are gone, they do not regenerate. They are lost forever. This is why recognizing the symptoms of a stroke and acting immediately is one of the most important things you can learn. The damage is permanent, but the extent of that damage can be limited by how fast we react. So, how do you spot a stroke? There's a simple and powerful acronym to help you remember the most important signs. FAST. F is for face. Ask the person to smile. Look closely at their face. Does one side of their mouth droop or look uneven? Does one eye seem to be drooping more than the other? Facial asymmetry is a classic sign that the muscles on one side of the face are not receiving signals from the brain correctly. A is for arms. Ask the person to raise both of their arms straight out in front of them and hold them there for 10 seconds. Watch carefully. Does one arm drift downward? Or can they not lift one arm at all? This arm weakness, known as hemiparesis, is another major red flag. S is for speech. Ask the person to repeat a simple sentence, something like "the sky is blue" or "don't cry over spilled milk." Listen to how they speak. Is their speech slurred? Are they using the wrong words or unable to speak at all? Confusion and difficulty with language are common because the language centers of the brain are often affected. T is for time. If you see any of these signs, facial drooping, arm weakness, or speech difficulty, it is time to call for emergency medical help immediately. Don't wait. Don't think it might just go away. Don't try to drive the person to the hospital yourself. Call an ambulance. The emergency medical team can begin life-saving assessment and treatment on the way to the hospital. Every single minute counts. When a person having a stroke arrives at the hospital, it's a race against time. The first and most critical step is to get a brain scan, usually a CT scan or an MRI. This scan has one primary purpose: to tell the medical team what kind of stroke they are dealing with. Is it a blockage, an ischemic stroke? Or is it a bleed, a hemorrhagic stroke? This distinction is absolutely vital because the treatments are completely different, and giving the wrong treatment can be catastrophic. If the scan shows a blockage, the goal is to restore blood flow to the brain as quickly as possible. One of the primary treatments is a powerful clot-busting drug called TPA, or tissue plasminogen activator. This medicine is administered through and for and works by dissolving the blood clot, allowing blood to flow again. However, TPA has a very narrow window of opportunity, typically within the first 3 to 4.5 hours from the start of symptoms. This is another reason why acting fast is so important. For larger clots, or for patients who arrive outside the TPA window, another option is a procedure called a mechanical thrombectomy. In this amazing procedure, a doctor threads a tiny catheter through an artery, usually in the groin, all the way up into the brain. They then use a small device to grab the clot and physically pull it out of the artery. It's like a plumbing snake for your brain, and it can instantly restore blood flow and lead to dramatic recoveries. Now, if the brain scan shows a bleed from a hemorrhagic stroke, the treatment approach is entirely different. You can't use clot-busting drugs because that would make the bleeding worse. Instead, the focus is on controlling the bleeding, reducing the pressure inside the skull, and protecting the brain from further damage. This might involve medications to lower blood pressure and prevent seizures. In some cases, emergency surgery may be necessary to remove the pooled blood or to repair the ruptured blood vessel. After the immediate crisis is managed, the long journey of recovery begins. The brain has an incredible ability to adapt, a quality known as neuroplasticity. Healthy parts of the brain can learn to take over functions that were lost from the damaged areas. This is where rehabilitation comes in. Physical therapy helps patients regain strength, balance, and coordination. Occupational therapy helps them relearn daily activities like dressing, cooking, and writing. And speech therapy helps with communication and swallowing problems. The extent of recovery varies greatly from person to person. Some people may make a full recovery and return to their normal lives. Others might be left with lasting disabilities, such as weakness on one side of the body, persistent speech problems, or difficulties with memory and thinking. But one factor consistently predicts a better outcome above all others: how quickly the initial treatment was started. The less time the brain spent without oxygen, the more brain tissue was saved, and the greater the potential for recovery. Of course, the best-case scenario is to prevent a stroke from ever happening in the first place. Strokes don't just happen randomly. They are often the end result of years of underlying health issues. High blood pressure is the single biggest risk factor. It relentlessly damages the walls of our blood vessels, making them more prone to blockages or rupture. Smoking is another major culprit. It thickens the blood, making clots more likely, and it damages the lining of arteries. Diabetes also injures arteries over time, and certain heart conditions, like atrial fibrillation, can create blood clots in the heart that can travel to the brain. These risk factors build up silently, often without any symptoms, until one day, the system breaks down and the brain pays the ultimate price. A stroke is not just a medical event that happens in the brain. It's a life-changing event that affects individuals, families, and entire communities. But there is hope. By managing these risk factors through a healthy lifestyle, eating a balanced diet, exercising regularly, not smoking, and controlling blood pressure and cholesterol with the help of a doctor, we can dramatically reduce our risk. And by educating ourselves and those around us about the FAST signs, we empower ourselves to act. Knowing the signs saves lives. Acting fast saves brain function. This is the simple, powerful truth about stroke. Understand how it works, recognize the signs when they appear, and respect the incredible urgency of the situation. Thank you for watching. If you found this information helpful, please share it with someone you care about. It could save a life.